And can you shrug your shoulders for me? And do it against resistance. Good. Now I'm going to go ahead and palpate the cervical process. Put your head down. Okay, good. And then I'm going to feel your muscles for your spinous process and your sternocleidomastoid. Okay, which is the muscles that you're using for your neck. Okay. I'm going to look at your chest now. Actually, you know what I want to do? I want to listen to your thyroid and your carotid, and I'm going to listen with a couple times, okay?
Okay.
Okay. And then I'll listen with this side as well. There's no murmurs that I heard. Thank you. All right, now I'm going to look at your chest. Can you take your shirt off for me?
Yeah.
Okay. Your breathing is normal and symmetrical. Your color of your chest has the tan appearance, and you have a light tan appearance. Your ratio is 1 to 2 for your chest and your back. For your thoracic, and the color on your back is the same as the rest of your body. You do have some macules, and they are on the thoracic. Primary lesions, and then I am going to go ahead and I'm going to palpate. Okay?
Okay.
You let me know if you're having any pain.
Of course.
All right, and I'm going to go ahead and feel your expansion. Can you take a deep breath? Perfect. Good. And then I'm going to go ahead and I'm going to percuss. All right?
Okay.
So let's go ahead and do your respiratory percussion first so I can see what your expansion is for that. Let me get some gear here. Okay, what I want you to do is take a deep breath. Let it out. Good. All right, now take a deep breath and let it out, and then hold it. I'm writing on you, but we can get it off with alcohol, okay? So I didn't want you to worry. Oh, good. That's 3.5. So that is very good, actually. And then I'm going to go ahead and percuss your back as well. Let me know if you're feeling any pain.
Okay.
Let me do something else. Good. Okay. Now, I am going to listen to your back, okay?
Okay.
And your breathing. Good. No adventitious sounds heard there. I'm going to listen to your chest as well. Take a deep breath. Perfect, thank you. Oh, sorry.
Okay.
No adventitious sounds heard there either. Now we're going to go ahead and do your cardiovascular. If you want to go ahead and lay down. Okay, so I'm not seeing any pulsations. Your respiratory rate when I did your lungs was 16. That's very good. And then I'm going to go ahead and check your heart right now. Do you ever feel any problems or jumps or skips?
No, not that.
Perfect. Okay. So what I'm going to do is palpate the point of maximal impulse right now, which is the 5th intercostal. Let me just check where I am. So it would be about here. Okay, so this is the 5th intercostal. This is the point of maximum impulse. I'm not feeling any murmur there. So this is the 2nd intercostal on the right side, and that would be the aortic. This is the pulmonic on the left, the same 2nd intercostal. 3rd intercostal is Erb's point. 4th is tricuspid. And 5th is the apex of the heart. So I'm going to go ahead and listen, and I'll listen with both the bell and the diaphragm. All right? I heard the S2 better on the aortic, and I heard the S1 heartbeat better on the tricuspid, which is the fourth intercostal for the tricuspid on the left, and right is the aortic on the second intercostal. And then I'm going to listen for murmurs now with the other side of the stethoscope. Okay. And I didn't hear any murmurs either. Now, I've already listened with both sides of the stethoscope to your carotid, and I didn't hear any murmurs there either. Your heart rate is about 73. That's very good. And I'm going to listen to your epigastric or your descending aorta when I do a review of your abdomen, okay? And then I'm going to listen, I'm going to feel the rest of your pulses. So I've already felt your carotid. Your temporal is very strong, actually. So that's nice. Your brachial. Your radial. And then your popliteal. You go ahead and relax. Good. Your posterior tibial. Good. And your dorsalis pedis. Very good vascular. Okay. Your pulse is very strong in all of those points, so that's very nice. And then, so whatever exercise you're doing, keep it up. Okay. Even when you're old, because that'll just help you to stay in shape and less likely to have any problems when you're older. So that is the vascular. Now we're going to move on to the stomach. Let me just get a couple things. I think I must have left a marker somewhere. Oh, here it is. Thank you. Okay. You okay?
Yeah.
You were nervous? All right. So I'm going to go ahead and listen. Your stomach, it doesn't look like you have any stretch marks, so that's very good. Your umbilicus is free of exudate, and it does not look infected at all. It's inverted and it's midline, and you have the normal hair pattern that you would have for a male distribution, and the color is good. I see no pulsations on your stomach at all, so that's very good. And I'm going to go ahead and I'm going to listen to the bowel sounds first. Okay, bowel sounds in all 4 quads, listening for a minute, it's 26, which is very normal. Okay, and I just heard the gurgling sounds, which is very normal as well. Now I'm going to go ahead and I'm going to listen to your organs and your liver and your spleen, okay, and for friction rub. No, no friction rub heard. Good. And now I'm going to go ahead and I'm going to listen to your kidneys and your descending aorta, which is in your epigastric, and your iliac, and your femoral. Okay?
Okay.
Iliac. Okay, good. And then your femoral, I'm going to defer, okay?
Okay.
The liver, I want to palpate the liver. Actually, I want to palpate your stomach and percuss. So I'm going to go ahead and touch, all right? You let me know if you're feeling any pain,
Okay.
all right? Good. Okay, and then I'm going to go ahead and I'm going to percuss your liver. So, take a deep breath, let it out. You're going to have marks all over you. Okay, I'm going to do that again. Oh, 9. I got 9 centimeters. That's within normal limits, so that's very good. I brought some alcohol with me so I can take off those spots for you.
Oh, okay.
You don't look like a zebra. Sorry. Okay. There. All right, now let's see. I want to palpate your abdomen. Don't feel any nodules. I didn't see any hernias, but I want to feel to see if you have any. You don't have any pain.